Most adults feel frustrated anytime they are handling a child with fever and a child who is not feeling well. So today's episode of the TDJ show, we are going to talk about fever in children, especially infants. You're welcome back to the TDJ show. Don't forget to comment, to like, and to share. So what is fever? When we talk about fever, fever is when the body temperature of any human being is above 37.5. Other people use other categories. Some say above 38, some say 37. But here in Ghana, we use 37.5 degrees Celsius. So if you have a child who is feeling hot and you use a thermometer, we don't want you to use your hand. You use thermometer and it tells you that the temperature is 37.5 or above that, then your child has a fever. What do you do when your child has a fever? Before we proceed, I have to let you know that fever in itself is not that bad, and fever in itself is not a disease. Fever is the body's reaction to something. So it's the body's immune system telling you that something is going on. So it doesn't mean directly that it is a sickness or something is happening, although it is a sign that it could be a sickness. So what causes fever? Lots of things can cause fever. Infections cause fever, yes. But other things like drugs can even cause fever. That is why when you take your baby to get vaccinated, when they come home, some of the times their body becomes warm and then we tell you to give them paracetamol. Yes, because some medications can actually give fever. Teething, when the child's teeth is erupting, yes, some of them also start having fever temperature, which you have to also handle. When somebody has cancer, trauma, all other things can cause fever. But today, our focus will be on fever that is caused by infection. On our very first episode, we elaborated on infection, saying that it is usually caused by microorganisms. It can be a virus, it can be a parasite, it can be bacteria, it can be a fungus. So today we are going to talk about fever caused by infection. Most of the time in the children, it's usually a viral infection or a bacterial infection or a parasite. And mainly when we talk about parasite, usually malaria, because malaria is caused by a protozoan, which is a parasite. Now, from the time of birth till the child grows out of the childhood, it becomes a teenager, they experience fever. But what causes it at these various stages differ. So when you have a child who is less than a month old, let's say a baby, if it's the first week of life, then usually that baby is most likely suffering from an infection from the mother. That means as the baby was being delivered, whether vaginally or via CS, the mother had an infection that the baby has acquired. If it's after 7 days and the baby has already gone home, then we are talking about an infection from the environment. So most of the time, maybe the mother had a prolonged labor or the membrane rupture, that is the water started coming way earlier than the baby came. All of these things put the baby at risk. And then if they go into the environment, sometimes how the baby is being handled, how the baby is being fed, the kind of environment the baby is being put in, all can cause the baby to have an infection. From 3 months going, you realize that maybe they are having a cold, they are coughing, diarrhea, vomiting. Sometimes some of them have seizures. You see them fitting, or there's an abnormal movement in their body. All these things are things that can happen to the children, and it tells you that the child is having an episode, let's say an infectious process going on, that is responsible for the fever the child is having. So when a child has a fever, these are some of the things that we look at. So what do you do? When your child has a fever, it doesn't mean that you should just give paracetamol and let the child stay home. No. It could be that it is a regular fever from vaccination. It could be that, like I said, all the other causes. But it could be that the child has an infection. You need to look out for other things. Is your child coughing, like I said earlier on? Is the child having a diarrhea? Is the child having difficulty breathing? Does the child eat well? Is your child crying unnecessarily? Sometimes the child is pulling on their ear. Sometimes the child is not able to eat because maybe the tonsils are swollen. All these things are pointers that the child has something going on. The fever is just the body's way of telling you that something is wrong. So when it happens that way, it's better you take your child to the hospital. Like I said, it can be a viral. When it is a virus, most of the time we don't give antibiotics or something. It can go on its own. But then you can never tell as a mother whether your child is having a viral infection or a bacterial infection or malaria or something of the sort. So we advise that when your child is having a fever, you take the child to a hospital. You allow the doctor to see the child. They will ask you all these various questions. Then they will examine the child. If it's a very little child, they will look out for jaundice, that is the child yellow. They will look out for lots of other things, maybe a discharge from the eye, a discharge from the umbilicus, all sorts of things. If the child is a bit older, they will look at the throat, they will look at the ears, they will listen to the chest, and then they will probably ask you to go to the lab where they might take blood or urine. Sometimes if the child is coughing, maybe a child above, let's say 2, maybe may have an x-ray done. You can have all sorts of things. If the child is having a seizure or the doctor thinks that the infection is in the brain, some occasions you have to take some fluid from your back around the spinal cord, which we call it CSF, to find out if the infection is in the brain. All these things can happen. So you have to go so that the doctor will examine and find out exactly which kind of infection your child is having, so that your child can be treated. The child will be given medication. Usually when it is a viral infection, we don't give antibiotics. What we usually do is we have to boost your immune system so that the body can handle it. So most of the time for viral infections, probably will give you some multivitamins, will give you, actually to let the child drink a lot of water, will give you vitamin C. Sometimes we'll add maybe some antihistamines to help ease some of the symptoms, especially if the child is, having a bit of a cough, a cold and all that. We give you something to make the child comfortable and to boost the immune system so that the immune system can clear it. But if it is bacterial or a parasite, then we have to treat it. If it's malaria, you need an anti-malarial. If it is a bacterial infection, you need an antibiotic. You cannot know on your own which one of them your child is suffering from. So you have to go to the hospital. Now, before you go to the hospital, as a mother, an auntie, a grandmother, or whichever kind of relationship you have with the child is, you would want to know what to do before you take the child to the hospital. What we are really worried about is what we call febrile convulsion in children. The kids are usually prone from 6 months to about 6 years. Around that period, if a child has a fever, the child can start convulsing, as in having a seizure, will start having an abnormal movement and jerks. Sometimes you realize that the eyes roll, they have foaming of the mouth, they start moving their bodies, or the body becomes stiff. Sometimes they become incontinent, they wee or poo on themselves. It means that the child has a seizure. And I don't think you want to see your child going through that. That is the fear we have when kids have fever. So what do you do in order to prevent that before you go to the hospital? So when a child has a fever, you have to make sure the child is wearing light clothing. You have to remove all forms of heavy clothing from the child. Make sure that the child is really drinking a lot of water. Encourage lots of water because it uses up a lot of body fluids. The child should get really well rested. You can give the child a lukewarm bath. I didn't say a cold bath, but lukewarm bath. That is what is advocated. We have to mix a bit of hot water with cold water to achieve the lukewarmness of the water before you give the child that kind of. Then you will give paracetamol. When you are giving the paracetamol, you should make sure that you give it every 8 hourly or 6 hourly. If you don't do that, in between, the child will have a fever, and we don't want that. We don't want the child to have a fever. So you have to give a clock, as a clockwork, every 8 hours, every 6 hours, so that we don't get a period in between where the child is having a fever. And as you do these things, then you prepare to take your child to the doctor so that the doctor can find out exactly what is wrong with the child and we can treat effectively. And infections have their own form of complications. We don't want to go there, but if the child is really suffering from a disease, they all have their complications. For fever alone, we are worried about febrile convulsion. Febrile convulsion, when the kids have it, it doesn't necessarily mean that they are going to be epileptic. It's the percentage is really, really, really small. The chances of a child being epileptic just increases from 0.5% to 1%. So it doesn't mean that your child will maybe happen to your child in the future. We don't want it to happen to them, but then you shouldn't be afraid if your child has had it once or twice. Your child can be perfectly fine, even if the child has experienced, a febrile seizure at one point or the other. So mothers, please take note. Learn how to effectively take care of your children when they have fever, and don't panic. Just do what you have to do and take them to the hospital. Please don't forget to comment, like, and share. We are ready to answer all your questions, so keep them flowing. Thank you very much for staying tuned.